Hi, Jackson Edwards here with Medicare Nationwide. In this video, we're going to be discussing the differences between the Plan G and the Plan N. We're going to look at the pros and cons of each plan and which plan might be best for you. Stay tuned. Okay, again, we're going to be talking about the Plan G versus the Plan N. I have the Medigap, choosing a Medigap policy in 2019. This is the kind of the guidebook for choosing a Medicare supplement policy. This is page 11, and you can see the supplement chart here. If you want a copy of this chart, you can reach out to us, or you can do a simple Google search of choosing a Medigap policy. It should be the first result you see. It'll be a PDF file which you can download. Okay, so let's put our attention right here on the Plan G. It's a pretty easy plan to explain. To keep it simple, it's 100% coverage of what Medicare A and B doesn't cover, assuming it's a Medicare approved expense. So everything has to filter through Medicare. If Medicare approves it, the Plan G will pick up 100% of that difference. You're only out-of-pocket expense on this plan. If you see this little missing box right here, and you follow it over, it's missing the Part B deductible. So basically, Part B is anything that happens outside of the hospital. It could be outpatient, ambulance services, lab fees, x-rays, MRIs, CAT scans, anything that's not skilled nursing or inpatient care, basically. So Medicare sets that deductible amount. In 2019, the deductible is $185. Last year, 2018, it was $183. Historically, it goes up about $12-15 per year. So just expect the first time you go to the doctor in that calendar year to be billed for $185. After you've met that, you're then covered 100% by Medicare and your Medicare Supplement Plan G. So very, very easy, very black and white, easy to explain, easy to understand. So let's go over here to the Plan N. So the Plan N is also 100% coverage. It's missing that Part B deductible as well, so you also owe the $185. It's also missing something called Part B excess charges, which we're going to go into in a second. And then you'll see that next to the Medicare Part B coinsurance or copayment, there's some stars next to it. So we can follow this down and look at the key down here, and I'll just kind of read this out loud. Plan N pays 100% of the Part B coinsurance except for a copayment of up to $20 for some office visits and up to $50 copayment for emergency room visits. So if that $50 copay at the ER, that gets waived if you're admitted into the hospital. So anytime you go to the doctor with the Plan N, no matter what is done at that visit, it could be a CAT scan, no matter what is done, it's a $20 copay. That's all you're responsible for. And I have many clients that rarely even have to pay the full $20. So usually it's less than that. So that's something to keep in mind as well. Where the plan sort of breaks down is the Part B excess charges. And this sounds scary, but it's very rare to see. So this has to do with Medicare assignment. You'll see Medicare assignment written all over the Medicare and You book, but they really don't explain what it is. So assignment is the doctor accepting the price that Medicare approves. So the doctors can charge whatever they want to. Medicare is going to approve a smaller portion of that. If the doctor is okay with accepting that amount, that's called accepting assignment. And not all doctors can charge Part B excess. Only certain doctors can. So you might see that at the Mayo Clinic, the Cleveland Clinic, Sloan Kettering, MD Anderson, these super specialists, if you will. So what is Part B excess? Doctors can charge up to 115% on top of what Medicare approves. So if Medicare approved $1,000, that doctor can charge you an additional 115%. So what you would do is take 1,000 times 0.15. So they can charge an additional $150. So with your plan N, in this scenario, you would owe the $150 plus potentially the $20 copay. So on a $1,000 bill in which Part B excess was charged, you can pay up to $170 in this scenario. So this may or may not be worth gambling with by going with the N. You might know your medical history. You might know that you're seeing a lot of specialists. So you can kind of already tell that the plan N might not be the right plan for you. But of course, that comes down to the premiums, in which we're going to get into in a second. Now, another scenario and where the plan N sort of breaks down is that $20 copay. So if you're doing something like physical therapy, you could be going to you can be doing physical therapy 3 times per week. So that's $20 each shot. You're doing that for 4 weeks. That's 60 times 4. That can get expensive, over time, and there's no cap on that. So there's no out-of-pocket limit on the copays that you pay, and there's no out-of-pocket on the assignment. So you have to kind of keep that in mind. Where on the Plan G, you know that once you've met that $185, that's your ceiling. You cannot pay more than that. Okay, so now let's get into some real-world examples. We'll pull up some rates here. So I just kind of take two random zip codes here. So now we're looking at Chicago, Illinois. This is a male Plan G, and the lowest Plan G rate in that area is $123 per month. So I'll kind of write this down on a notepad here. Okay, so I got the $123 premium written down here for the Plan G. Now let's look at the premium for the Plan N in the same zip code and scenario. So now we've got the Plan N with Aetna here at $98 per month. So I'll put Plan N, 98, and then we can take the difference in the annual premium between the two plans. So I'll take 123 of the G, subtract $98 of the N. I get a monthly savings of $25 per month. Let's multiply that by 12. So our yearly savings in this scenario is $300. So knowing what we know about the risks of the Plan N, in this scenario, $300 a year savings probably isn't worth it, to me anyway. I think having that peace of mind of just having the $185 out of pocket and that's it, I think for $300, I'll pay that extra $300 to have that peace of mind, because there's value in that as well. Now, let's take another look at another zip code. So here we've got Vermont, zip code 05030, and we'll write down, let me put this up here, Illinois, and then we'll go over here, we'll put Vermont. All right, so the Plan G in Vermont is call it 177. All right, and then we'll go over to the Plan N, and we've got a monthly premium of 123, and do the same thing here. We'll take the 177, subtract the 123, and multiply that by 12. Now this is a little bit more compelling, so we'll put $648 yearly savings. So let's just divide that. We'll take the 648, we'll divide it by 20. So that means you would have to go to the doctor 33 times, because the copays are $20 per visit. You'd have to go 33 times before you ever lost money on this plan, assuming we didn't run into any Part B excess charges. So the $648 savings is a little more compelling. I might be more obliged to go with the N in this scenario. But if I'm speaking with a client, I'm presenting them with these two options. I'm letting them know the pros and cons, and sort of maybe letting them kind of go what's most comfortable for them. Where the Illinois scenario, I would probably urge them not to go in the N in that scenario. So you can see where the plan, whether going with the Plan G or the Plan N, it's really a case-by-case basis. It's dependent on your health. It's dependent on your budget. It depends on where you live. Depends on the yearly savings versus the Plan G versus the Plan N. So you kind of take all these things into consideration, make an informed decision, and kind of trust your instincts in this scenario. If there's any other questions you have, or if there's things I didn't address, please leave a comment below or give us a call. We're always happy to help. All our contact information can be found below in the description. If you found this video helpful, please give us a thumbs up. We will be putting out more helpful content like this in the future, so feel free to subscribe to our channel. Have a great day, and thanks for watching.